Again, good afternoon to everyone. We are now having our course for this afternoon of the Pathophysiology. And we will have our first topic on the introduction to pathophysiology. When it comes to pathophysiology, sir, why do we need to have the basic understanding on pathophysiology? It is very important for the nurse to have basic knowledge and skills actually in pathophysiology simply because this will be your level of competence that it will be needed so that for you to facilitate discharge of your performance as future professionals. There are some instances that even in your own families, you are being asked, what is the cause of this particular disease? Why why I have been infected by this disease? What specific measures may I do or can I do to prevent the disease? Why the doctor requested me to have laboratory examination of urinalysis? Why my heart is beating fast and yet I am not a comorbidity? Probably some of you may ask, why the priority population for vaccination are the elders? Why healthcare workers are prioritized to be vaccinated? And eventually, why individuals with comorbidity are being prioritized also to have the COVID-19 vaccine? It will now circulate to your body and even to your mind with your neurotransmitters how you will respond to these questions. And probably this pathophysiology will be the one, a course, that will be part of your guide on how you will develop those skills and competencies on how pathophysiology is very relevant in nursing. So as what I have mentioned, our topic 1 is Introduction to Pathophysiology. Let's start first on the course description. Pathophysiology could be considered as the study from the term itself, patho, physiology. The logy stands for these are being used as a study. But what about the patho and the physio? When we talk about pathology, this studies about the root cause or the disease process, how it had been developed, how it started from the time that the person have been exposed, from the time that the person have experienced the risk, and from the time that the causative agent or the cause itself or the causative factor itself mainly affected our normal functioning. If you can remember way back in your fundamentals of nursing, you have discussed about health equilibrium. If we say equilibrium, that is the state of what? Can I hear answers? The state of
Equality po.
the state of equality, the state of balance. Okay. If you assess yourselves now that you are well physically, mentally, emotionally, even spiritually, the holistic view of a human being could be considered as a healthy rather, if in particular you're in the state of equilibrium. However, if you feel anything unusual from your normal body responses, you may ask a question of why I have this feeling, why it is happening in my body, why it appeared in my skin, why I have difficulty in swallowing, why I experience epigastric pain. These are discomforts. And probably these are things by which we can answer if we may know from the start of our analysis of when and how it started. What is the cause or the agent that lead to that problem? We may be oriented of signs and symptoms. That's why even in our present times, COVID-19, I know each and every one of you have the mastery already of identifying signs and symptoms of COVID-19 infection. If someone coughs, COVID-19 agad. If someone has fever, COVID-19 agad. In our present times, we could have that perception. But remember, class, not all individuals who have who experience coughing will always be subject and concluded as, you have COVID already. No, because there are also other reasons why the coughing reflex are definitely stimulated. In situations, for instance, that a person may have fever, you cannot just only say that the person who experienced fever and who is febrile may only be directed only to have COVID-19 infection. Do we have also other cases or other diagnoses or illnesses that has symptoms of fever? Yes or no? Do we have other illnesses or sickness or the diagnosis that have symptoms of fever? Yes
Yes.
or no? Do we have?
Yes po.
Yes. Very, very low tone. Yes po. How about for the others? Okay. So yes, because just like in situations that okay, sometimes in your perception, all who may have fever will be considered as infection, but not all. There could be possibilities that fever can be caused by a problem with inflammation. So let us now analyze and use our critical thinking of this person has a fever, but you are thinking that is it caused by an infection or is it caused by inflammation? How you will answer that? That's why, di ba, you have been oriented on how to do patient history. The patient history itself, the medical history itself can definitely identify specifically on the start and from the time that the person had been exposed to risk factors. And this could be the basis initially by the nurses who are attending these clients. Just like, for example, can you imagine that you are assigned rather in emergency room? Will you conclude already in 1 minute for every person who enters the emergency room and has only one symptom? Can you conclude already in 1 minute that the person is already COVID-19 because of
Opo.
fever? The answer is no. What could be the basis for us to have a confirmation that the client having a fever is either having a problem with infection or having a problem with inflammation? It is through what? What could be the reference that we could use so that to confirm if the fever that is manifested by the client is caused by infection or caused by inflammation? Anyone from the group? Anyone from the group? How can we confirm? How can we identify?
In-try lang po.
Yes, Miss Sipin.
Para po ma-identify yun yung sa mga laboratory exams po.
Correct. You're definitely correct. Because diagnostic examinations can definitely guide us on what could be the initial cause of the problem. Do diagnostic examination will reveal us or will reveal to us and give us confirmatory diagnosis? Yes or no?
Yes po.
Yes. So laboratory examinations are very powerful, but do those nurses are aware on how to interpret it and connect it with the initial care management of the client? Is it very important? Yes or no?
Yes po.
Yes. Because eventually, with those individuals who will be coming into the emergency room, they need immediate care management. And your reflexes must be considered. Fast reflexes must be considered. You must be reflexive, because anytime that you may not attend to the client may lead to a possible mortality. So that's why in this course, it is very important on how you will connect your knowledge with risk factors. How is these risk factors lead to deviation in the normal functioning of the body? With the diagnostic examination, how you will connect it with the signs and symptoms, and with the results, other than with the results of diagnostic examinations, what could be the appropriate treatment management, including pharmacological management. Even in the pharmacological management, there are drugs. For example, during at the time that you have attended to the client, it was confirmed that the client is having infection. But again, we will now have another two dilemma. Is it viral or is it bacterial? Do you think we may have different management for viral and bacterial infection? Do we have different management for viral and bacterial infection? Yes or no?
Yes po.
Yes. Obviously, with the pharmacological management, the viral infection is definitely be treated by pharmacological management of antiviral. While obviously the bacterial infection may be given antibiotics or antibacterial. What will happen if, for example, the drug that had been given to the client is having viral infection, but you are giving antibiotics? Are you meeting the objective of the treatment regimen? The answer is
Po.
no, 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 no. Are you leading the client to your objective of recovery? No, 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 no. The problem is that of you're out of the supposedly appropriate treatment regimen for the client. And it will always start to the nurse's perspective on how to initially assess the client. And pathophysiology is very important. Even in the pathophysiology, you have learned the normal findings. Normal findings when it comes to physical examination. These normal findings will be your reference so that it will be identified by the nurse if it is already deviation. If it is considered as deviation, what will be the measure of the nurse? To dig further on how to identify the specific diagnosis of the client. And that's the time that we will consider diagnostic examination. And once the client has already the diagnosis, the confirmatory diagnosis set by the diagnostic examination, do we stop there on our care management? The answer again is no, 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 no. It's because you still need to monitor the client, because the chances that the client will be what? Risk naman for complications. So do we need to monitor that as nurses? The answer is yes. Just like if, for example, di ba we are familiar with COVID-19 with mild, moderate, and severe. At this present times on your orientation with the information available in the social media, which of the classifications of COVID-19 will be subject immediately for hospitalization? What level? What level?
Severe
Mild,
po.
moderate, or severe? The severe. Why is it that we prioritize to be considered for hospitalization ang severe cases? Can you explore and answer on it? Why do we need to prioritize severe COVID-19 to be hospitalized compared to mild? Di ba before ang mild ina-admit in the hospital, but now we are now considering mild as for home management. So I saw raised hands So probably we can start with Miss Jana, Miss Mesa.
Yes po. For my opinion naman po, kasi I experienced COVID-19 last month po. So mild to moderate symptoms naman po. Nakayanan naman po. Pero yung ibang kasama or yung ibang family members ko po nag-severe po. So in that case po hindi pa po sila vaccinated. So mas ano po talaga yung COVID-19 cells po sa lungs nila. So mas nahihirapan po silang huminga. Pero in my case naman po na oxygen support naman po ako pero vaccinated po ako.
Yeah.
So sa mga severe cases po kaya po sila na-admit sa hospital kasi nahihirapan na po silang huminga. The same time baka meron din po mga other ibang sakit po na pwede pong maka-add sa pagiging hirap po silang huminga. Kaya na-admit po yung mga severe cases po.
So before we proceed with the others, you have 2 points that had been addressed. The 2 points are the following. You already compared your experience as vaccinated to the other family members who are unvaccinated. It flows now in your mind. It already flows in your mind the concept of pathophysiology because you have concluded that you might experience mild as a mild case because you are vaccinated, and the other members experiences moderate to severe because they are unvaccinated. When it comes to pathophysiology, what is basically the risk factors that those client experiences mild case and the other one is severe case? So you have already answered it. Mild because you have been vaccinated and the vaccine itself strengthen your immune system to prevent complications. Unlike for the other members who have not been vaccinated, they have experienced moderate to severe symptoms because of the chances that the virus entered their body wherein their body do not have enough strength on immune system because they have not been vaccinated. Thank you for that sharing. You are already using pathophysiology concept in those situations. Thank you. How about Jude? Mr. Guangco.
Hello po. Rinig
Yes.
po.
Yes.
Dun po sa mild to moderate po, with proper home management po, malalasan yung mga symptoms. Unlike po dun sa may severe part naman po, maybe po yung COVID, nakikipagtulungan with other diseases or may other symptoms pa na medyo rare kaya napupunta po sila sa hospital, which is hindi na po kaya i-manage at home. That's all po.
Okay. So Mr. Jude, let us analyze your answer. Thank you very much. This is now a different perspective on how Miss Jana presented her experience. You have presented a case wherein the cases of having moderate to severe possibly are those individuals who may have comorbidities. Am I right, Mr. Guangco? Comorbidities, persons who may have other diseases when they experience the symptoms of COVID-19. Am I right?
Yes, you're right.
Yes. So just like, for example, the persons who may have diabetes, which have been confirmed that those who are having diabetes are high risk for complications simply because it really affects their immune system, even though they are vaccinated. So compared to an individual who is well and can support the strong immune system, then this can basically do not have rather comorbidity. The response to COVID-19 is different from the perspective that the one is having comorbidity because of the functions that the function or the physiologic or the normal functioning of that person with diabetes may significantly affect the organs of the body, while those who may not have comorbidities can still have strong immune system because you are on the normal functioning and can be can fight strongly yung body defense against the COVID-19. So that's another perspective. What you have used in your response or answer is basically a person who may have other diseases other than COVID-19, and for those who have not been identified with other diseases and first time experience with COVID-19 may have different responses. Okay, very good. How about Jervin Mateo? Anything to say?
Similar to what they have said po, it is important to first prioritize severe cases po, because they can experience that po in a much higher risk or chance due to
Correct.
compromised immune system po, as mentioned, then compared to those who are mild and moderate cases. Yun lang po.
Correct. Thank you very much. The one that you have mentioned and shared with us is on the perspective that those who can be admitted those who will have severe cases are subject for hospitalization simply because of the perspective that they need more medical attention, right? Because most, if you will consider, di ba, during the time of the early period of the pandemic, most of the severe cases are already transferred or admitted in intensive care units. Kasi their condition are very critical eh. Anytime with their condition, with the complications, it may lead to death. So that's why nurses will attend to these clients with critical conditions of COVID-19 more on a perspective of maximum time of attention compared to the one who may have mild cases. So that's why it goes with a different perspective now. Mild cases can be managed at home, but for still moderate and severe may need to be admitted in the hospital because it may need medical attention and it may need monitoring of medical experts. So thank you very much for that sharing. Any other who wish to share of why we conclude now? Before kasi, as what we have mentioned, mild cases are admitted in the hospital, but now it was advised na lang to have home management, and critical cases are definitely be subject for admission. So can you imagine yourself attending to a client in critical condition pero home management? Will that be possible? Will that be possible? Severe case will be on home management. Any response from the group? Will that be possible? If for example, the hospital are on full capacity, then the situation goes that okay, there's no space for the occupancy for the ICU. Will it be possible in the situation that a critical case will be managed at home? Any insight? Any insight from the group? Yes, Mr. Guangco.
For me po, 50-50. Possible
Mhm.
because if with a proper equipment and needed to
Correct.
that patient po, meron sa bahay. But if not, hindi po talaga kaya.
Correct. Thank you very much, Sir Guangco. You have a correct perspective. Kasi individuals who are being admitted in the hospital which fit in a critical care unit, specifically with the complete equipments. The complete equipments can facilitate assistance in breathing, such as the ventilator, and a cardiac monitor to facilitate the monitoring of the heart rate every hour or in real-time monitoring. Unlike for critical cases that can be subject for home management, it may not be effective simply because it will be in the absence in the absence of a medical expert. In case of emergency, it may not be attended with an incomplete equipment and supplies at home. So that could be an analysis. Thank you for that. So going back to our pathophysiology. Now I am gaining from your experiences, and at the same time we are connecting of what are with those experiences and those insights and sharing that you have, how we connected it to pathophysiology. So the mild, moderate, and severe cases have been identified and classified accordingly as based from symptoms, right? Kasi if for example, actually, di ba, we have pa asymptomatic pero positive with COVID. So, symptom based ang assessment natin. So that's why if a person is having difficulty of breathing, then we may suspect that the person who may have COVID-19 is a critical case because this could not be managed specifically without oxygen supplementation. So, why? Yan, you will answer why. Why on a person with difficulty breathing cannot manage and may need to transfer to the hospital for immediate oxygen supplementation? Are you aware of the pulse oximeter? So, most of you or some of you have this at home, the pulse oximeter that measures
po.
the pulses and the oxygen saturation.
Yes po.
Yan.
Yes.
Very critical if the oxygen saturation is below 94. It's very critical. Because usually, the reference natin is 95 to 100 as the normal oxygen saturation. If it is below 94, 93 down, it's very crucial to monitor it more frequent because this is an indication that your body is deprived from the circulating oxygen. That may affect the different major organs of the body, specifically the lungs, that is really very important for gas exchange. So on that note, why do we need oxygen supplementation? If, for example, if the client is having 70% of oxygen saturation and we are oriented that the normal oxygen saturation is 100, how many percent is lacking if our reference is 100 of oxygen saturation? So lacking is 30%. How can we supplement the 30%? It's through the oxygen supplementation. And with that, it must be with the knowledge of the nurse on how it will be supplemented. So these are the concerns na if it will not meet the 100%, there will be a continuous deviation in the body functioning that may lead to complication. So what could be the possibility that if it will continue deprivation of oxygen? Possibly the patient may have ischemia. Emia is referring to blood. Is referring to insufficiency, lacking of oxygen. Next, lack of oxygen may lead to hypoxemia. What is hypoxemia? Hypo is decrease or increase? Hypo. Decrease or increase?
Decrease po.
Decrease. Emia is referring to blood. So meaning from insufficiency of oxygen, which is ischemia, it may lead to hypoxemia, which is decrease of oxygen in the blood. Now, will it affect if it continuously have lack or decrease of oxygen in the blood? Would you think it will affect oxygenation of cells? Would you think it will affect the oxygenation of cells? Answer is
Yes po.
yes. If the cells are the ones being affected with the oxygen level, then that is what we call hypoxia. Now, different perspective, right? It starts with ischemia, insufficiency of oxygen. The person is not having the oxygen supplementation. What comes next? It will affect the oxygen level in the circulation, which is hypoxemia. If there will be decrease in the oxygen in the circulating in the circulating blood, it will also decrease the oxygen supply to the cells. If it will decrease the oxygen supplies to the cells, then that becomes hypoxia. And what comes next? If the cells will be deprived from oxygen, what comes next? Tissue death. So can you see now the flow? Can you see now the flow? From the time that the person had not supplemented with oxygen, from the time that the oxygen is insufficient, up to the time that the cells are already affected, it may lead to death. So those are the analysis that this course will give you and will supplement you as learning. Remember, I am just a facilitator of learning and you are the learners. You must also have the interest to put out all what you are thinking based from your experiences. And I want to hear from you, your experiences, so that we can relate it to our subject matter. So as what we have mentioned, this is the study of pathology. Pathology, these are the study of diseases. And this will focus, our course will focus on the general health management of diseases. Class, I just want to ask, it was mentioned in our course description, across the lifespan. Sir, what does it mean? If we say across the lifespan, you have been oriented with growth and development in pediatrics, right? Have you been
Yes
oriented with
po.
growth and development?
Yes po.
Diba? It starts with the infancy up to the late adult, right? Do you think with this population, with this population groups or development, do each of the from infant, toddler, adult, and the elders, do they have the same response when exposed to infectious diseases? Do they have the same responses?
No po.
No. That's why if you notice why individuals are grouped together when it comes to vaccination. Have you noticed that? Not the vaccine is not for all ages until the study will be proven that this will be safe for each group. If, for example, since the studies have started that these are safe for adults, if there are no studies that this will be safe for the pediatric clients or children, they are the last population group that definitely recommended the vaccination, right? So probably the population group of the elders and the adult had been considered. Think again of what's the connection. Why? I want to have the answers of anyone, ha? Why is it that it has been a priority to consider the elders for vaccination rather than children? Sige nga. So, Gabriel, yan. Gabriel De Castro.
Kasi po, yung mga elders po, sila po yung mas prone and susceptible po sa virus. Kasi mas
Okay.
mahina na po yung immune system nila compared po sa mga young. Or
Okay.
young.
So, you are correct. Pero syempre, you need to think deeper pa. Kasi we have been oriented that the elders have weak immune system. The children have strong immune system. Follow-up question to facilitate yung concept natin with pathophysiology. Why elders have weak immune system and why children have strong immune system? Anyone? So, I think Miss Pelin raised her hand. Shenny May?
Sir,
Yes.
sir yung para po sa akin yung mga elderly po. Sila po yung ano na po, yung mababa na po yung nagde-decrease na po yung efficiency po ng function pagpa-function po ng body po nila. Kaya po mas prone po sila dun sa yung pagkakaroon po ng imbalance yun po sa kaya po ayun po.
Ayan, sige. Actually, you're getting deeper na. You have mentioned about kanina, it was mentioned that for elders, weak ang immune system. Then you have responded that yung efficient functioning niya ay slow. Now, let us be more specific. Be more specific of why there is a decrease in the functioning of the elders. Sige, Mr. Jervin, can I hear from you?
For me po, besides immune system po, I believe that their respiratory system po is much weaker compared to the young ones because ayun nga po, mas mahina po kasi kaya po mas nahihirapan sila makakuha ng oxygen kaya po sila po yung kailangan mo na i-vaccinate compared po sa mga maliliit. Yun lang po.
Okay. So you are almost getting there na. You're almost getting there. So I'll call Miss Sipin.
Sir, kaya po gano'n kasi 'di ba po yung yung sa elderly natin is nagde-decrease na po yung kanilang immune system while the child naman po is parang alam niyo po yung 'di ba pagka nagva-vaccine tayo para mas nag-i-improve pa po yung so nagkakaroon pa po ng mas yung bata parang pataas ng pataas po yung immune system po nila parang gano'n po.
Okay. So you're almost getting there. You're almost getting there. You're connecting it with the immune system. How about Miss Katrina Prestosa? Katrina? Miss Prestosa? O sige, let's call muna Mr. De Castro. Gabriel.
Sir, kasi po, effects po ng aging is mas kumukonti po yung white blood cells na nagre-respond po sa new antigens. Kaya po mas susceptible po sila sa infections and diseases po.
While the children or the population is opposite with the response of the elders.
Yes po.
Okay. So you're getting there. You're almost getting there. So you will think of specific na why is it double, di ba, the white blood cell, it has a common responsibility with the immune system, right? O another I may give you, before I call the others, I may give you another example. Do hormones are very important in cell functioning?
Yes po.
Yes. 'Di ba meron tayong menopause, meron tayong andropause. 'Di ba? Sa andropause at menopause, ang hormones natin nagdi-decrease habang tumatanda. Right? And sometimes pag ikaw ay menopause na, talagang the production of the female hormones ay decreasing na. If there will be decrease in the hormones are very important when it comes to stimulation of active response of cells. Right? Di ba sa endocrine system, ang hormones ay specifically it will help the active response of the cells. So do you think if the person is continuously lacking hormones in the increasing age, nagdi-decrease then it cause decrease also of response of cells? Habang bumababa yung hormones, bumababa din yung response ng cells. If bumababa yung response ng cells, bumababa yung defense ng immune system against infection. Kaya mas prone ang elders. Will that be possible? You can oppose, you can oppose. You can oppose. I may not be perfect in my explanation, but I am now open. I am now open to oppose to oppose any or to object with my response. Di ba yung analysis, it brings you more confidence. That's why pala if the immune system of the elders are weak, kaya pala they have been identified agad without hesitancies highly vulnerable population because of the knowledge that yung physiologic changes that happen to an elder is different from children kasi sa children hormones are active. From adults, hormones are active kasi pa-puberty. So on that note, if you will notice during the early COVID-19 pandemic, very few ang mga nagkakaroon ng COVID-19 cases for the adults, for the early adults at saka sa children because the cells are responding actively with the help of the hormones of the body compared to an elder or to elders who are menopause and andropause whose hormones may not anymore facilitate the response of the cells to have a strong defense of hormones. Kanina, minention ni, I think, am I right, Mr. yung about the respiratory for the elders? Who answered that? I missed the name. Mr. About the respiratory system? Mr.
Mr. Mateo was speaking.
Yeah, Mr. Mateo. Yeah, Jervin. You have mentioned about the respiratory system. You have mentioned that the elders are more prone to or high risk for the development of severe cases compared to children. We have the what we call elastin. Elastin is an enzyme. Okay? Elastin is decreasing upon increasing age. Elastin is the one that facilitates, from the term itself, elastic. The elastin is a substance or in an enzyme very particular to help the lungs expand to the maximum and facilitate proper oxygenation. In the increasing age, elastin is decreasing. So you can now compare. The children have intact elastin. They can breathe to the maximum level and maintain their oxygen saturation. While the elders have decreased elastin that may not facilitate maximum expansion of the lungs to meet the normal oxygen saturation. So that brings concrete answer of why the elders are high risk for the development of the infection compared to children. Di ba very interesting? It dig to specific responses of how you will answer specific questions. You started with the general answer, weak immune system, the WBC, ayan, pumasok na yung WBC, which is based from the physiologic changes in the increasing age. So that is very important. That's why in pathophysiology, we can conclude that the changes when it comes to the physiologic function may vary from the time of birth until the patient or the individual reaches the late adulthood. And class, since we have started already the discussion of how to identify the symptoms, the signs, I know you have studied about the probable signs and the possible signs of pregnancy. Am I right? Okay. What could be the confidence it may give you if you know the probable and the possible signs? What could be the confidence it may give you if it is a probable and a possible sign of pregnancy? It will give you the confidence of the possibilities of closest to the chance if the patient may not have still pregnancy test, you can already recall of the possible signs that the individual is pregnant, even without yet a confirmatory test. The nurse may possibly even still the client may not have the confirmatory pregnancy test, but the nurse will already initiate protection of that person. If you can still remember in our pharmacology, di ba we have discussed about substance abuse. Yung sabi natin before, if we have too much or almost 1 ounce or 2 ounces of alcohol that a pregnant client will take, the mother could be high risk for abortion. The fetus could be high risk for fetal alcohol syndrome. Aware ka na. So that's why if you have known that the individuals has already the possible signs, what the nurse will do is to remind that person to have pregnancy test and somehow prevent her to take the alcohol, because somehow if the person is not aware that she is pregnant already, it may cause the possibility that the alcohol has a direct impact on effect pertaining to the condition and well-being of the fetus, which may lead to fetal alcohol syndrome. Now I hope you have the appreciation already of why pathophysiology is very important for nurses. I even presented to you before in pharmacology, if you remembered. Di ba we have the FDA risk classification or a risk classification for the drugs for pregnant women. So why is it that you need to have that knowledge of the risk classification, yung risk category A, risk category B, risk category C up to X? It's because you are aware that this may cause an effect to the mother and to possibly to the fetus. And that gives you the idea of how these drugs will cause an effect to it and why is it categorized as category A. Pathophysiology can give you those answers. It will be in your mind that for every whys, the pathophysiology could be the answer on how you will dig for the specific answers on those questions. Just like the topics that we could discuss is we will have discussion of etiology. Etiology is referring to manifestations. Symptoms are I know this has been discussed to you in fundamentals of nursing. What's the difference between sign and symptom? Which of the two is subjective, which of the two is objective? Miss Prestosa.
Hello po, ayan. Yung symptoms po yung subjective po.
Okay.
Yung signs po yung objective po.
Okay. The symptoms could be subjective if the client verbalize, right? If the client verbalize about what is happening in her functioning, while the signs are the ones that have been the results that will be considered as results of diagnostic exam, results of your physical exam. That's why you always consider in the signs vital signs. Kaya nga siya vital signs because it gives you specific results. Kaya best that you may have the signs because it will give you direction to confirm specific diagnostic examination for further study or for further evaluation. So hoping on that note, the pathophysiology will give you a background specifically on how you will know pathognomonic sign. What do you mean by pathognomonic sign? Signs that are only particular on those diseases. Okay, let's try to have an overview. Do we have a difference of type of rashes for chickenpox and measles? Have you encountered individuals with measles? Students? Have you encountered individuals with measles? Or have you
Yes po.
seen? Have you seen a pic? Have you seen a photo or have you encountered individuals with measles? Okay, correct. Have you seen an individual with chickenpox?
Yes po.
Yes. Can you cite the difference of the rashes?
Yung sa rashes po din ng chickenpox po is parang mga small dots po siya na medyo may mga distance.
Okay.
While naman po yung sa measles, para po siyang, alam niyo sir, yung parang pachi-pachi na flat. Na may
Okay.
iba po, may ano po siya. Yung sometimes naman po sa measles na iba is may parang konting, ano po siya, parang konting umbok.
Okay, ganito. Thank you, Miss Sipin. Di ba I have described to you yung hypersensitivity reaction in pharmacology. Ang tawag natin doon urticaria. 'Di ba? Ang if you will notice ang rashes ng allergic reaction, hindi siya patterned, right? If you will notice that, hindi siya patterned. 'Yon, para siyang patches. But if you will notice sa measles, para siyang dots, red spots. Yung mga red rashes, flat, tapos red. Red siya, right? Na most makikita yan sa trunk. If you will notice sa chickenpox, ang rashes niya ay vesicular. Pag sinabi natin vesicular, naka-protrude tapos with fluid. May fluid inside, kaya siya vesicular. Ang macular rashes ay yung flat tapos red. Macule ang tawag doon. Ang vesicle naman ay yung rashes that is described with fluids just like chickenpox. Ngayon, if you have seen a rash na pattern siya, it has fluid, vesicle siya, tapos distributed all over the body, will that be measles? Answer is no, 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 no. Because you have been oriented that the type of rashes that are significantly identified for chickenpox are vesicular. Rashes protruded with fluid. Alam mo na, suspecting ka na for chickenpox. Will that be infectious? Yes. Chickenpox is viral. That's why ina-isolate ang may chickenpox. How about measles? If you will notice for a measles patient or a measles client, ang rashes niya ay flat, tapos red spots. Red spots siya, or petechiae, should we say. Ang tawag naman doon, macule. Can you say that is Chickenpox? No, because that is a macule. A macule, the macular rashes that are distributed all over the body. Possibly measles. If that is measles, viral class. Do we have different what do you call this? Do we have different management for measles and chickenpox? Do we have different management? The answer is yes. If you're aware of that particular signs that you have observed, and with your knowledge that those type of rashes significantly as a pathognomonic sign of chickenpox, and that rash of macular rashes is significantly for measles, then the nurse will have the appropriate care management. So can you see the connection? The basic knowledge of assessment will be connected on how you will have your appropriate care management. Just like in our course of pathophysiology, the topics that we may consider are diseases and injuries. So let's have a typical example. A person who experienced vehicular accident. A person who have experienced vehicular accident have heated, hit, na hit siya. Have heated the head, okay? And leaded to loss of consciousness. Okay, now, can we explore now of why the person who have been heated his head during the vehicular accident experienced loss of consciousness? Sige. I want to hear from you. I want to hear from you. Di ba class, there are some individuals who have experienced vehicular accident, na-hit yung head, pero conscious pa rin. But there are also vehicular accidents that heated yung head and lost yung consciousness. The question is that of what is the cause of loss of consciousness from that vehicular accident that the person experienced? Can I hear anyone from the group? Anyone from the group? That why that person who experienced head injury through a vehicular accident have lost its consciousness? Yes, let's start with Miss Mesa.
Maybe po natamaan po yung sensitive part of the brain po, especially po if doon po sa connected part with the spinal cord po. That's why po na-lost po yung consciousness po nila. While the other person naman po na naka-experience po ng vehicular accident na hit din po yung head pero hindi po na-lost yung consciousness po nila. Maybe po minor lang po yung natamaan po sa head po nila.
Ayun. So you are now referring to your foundation of basic knowledge with anatomy and physiology. Na we have part of the head, specifically the brain, that is responsible for consciousness. You are referring to that point, right? Na for example, for a person who is conscious, you could say a minor injury, right? Then for a person who have lost the consciousness, you may say it's a major injury. So on that note, probably the part that you are referring to is the possibility that the reticular activating system of the brain, who is responsible for the sleep-wake cycle, could be possibly injured. Diba? So the less injury that the brain may have, the chances that the person is responsive. The more injury that the brain encountered, the less response that the person may have. So that could be one. So you are now learning. How about the others? Let's ask Miss Torre, Eliza.
I think po, probably the reason po kung bakit nawalan po ng malay si patient is because po nagkaroon po siya ng trauma po sa brain which could be a concussion po, which is a risk pag nabangga po yung ulo ni patient into something na hard po. Yun po.
Okay. Kung nag-cause ng trauma, will it lead to a possible cause of tissue damage? Will that be possible through that concussion? Pwede bang
Yes.
nag-cause yung impact niya, yung trauma niya, pwede bang mag-cause ng tissue damage?
Yes po.
Yes. Kung nag-cause siya ng tissue damage, is it possible na may bleeding? Posibleng bleeding? Posible.
Yes po.
Would you think that yung bleeding may cause yung pag-fill up do sa spaces ng open spaces ng brain? Pwede siyang mag-leak. Will that
Yes.
be possible? So
Yes.
will it be possible that the continuous bleeding will compress the brain?
Yes po din.
If it will compress the brain, would you think that the circulation in the brain will be affected?
Yes po, kasi may blockage po dun sa
Okay. So
space.
if there is a pressure, would you think it will deprive oxygenation?
Yes po, dahil sa leakage po.
Correct. So if because of the leakage and will compress yung bleeding niya, hindi continuous mag-circulate, would you think that the cells will be deprived from oxygenation?
Yes po.
And if the cells will not respond to the oxygenation, do you think the patient will not be responsive?
Yes po din.
And that is the answer why the client is unconscious. Oxygenation is very important. From your response, kasi initially yung response mo trauma. Then syempre you elaborate more, di ba? You elaborate more. What is in the trauma that will make the person having a problem with loss of consciousness? Think. Yung kaninang answer is minention niya na merong direct na hit dun sa brain. Ano kaya, what is specific in the part of the brain that is related to the consciousness? Yung sa'yo naman, ang problem natin na na-connect is the trauma itself lead to bleeding. Di ba? Kaya sometimes, di ba, na minsan you will listen to this situation na have you encountered yung mga naririnig ninyo na stroke? Pag nadinig nila yan, di ba usually pag nawalan ng malay yan, usually it's either na-experience yung fall, tumama yung ulo. Why agad pinapa-MRI or magnetic resonance imaging? It's to simply check if there is bleeding. And that bleeding may compress the brain. And from the direction of our discussion, if the brain will be compressed, mako-compress yung blood vessel. Pag na-compress yung blood vessel, mabablock yung circulation. If it will block yung circulation, it will block yung oxygen level, yung oxygen distribution. If it will cause insufficiency of distribution of oxygen, it will deprive the cell. And if it will deprive the cell, pwede ba siyang mag-cause ng cellular death? Pwede bang mag-cause ng cellular death pag continuously deprive ng oxygenation?
Yes po.
And that possibly may lead to death of that individual na. Pag hindi na support yung continuous oxygenation to the brain. So magkaiba yon. Kanina kinonect natin on the oxygen. Nawalan pa lang siya ng malay. But why there are some others that experience vehicular accident pero dead on arrival? It's because the possibility of too much bleeding itself nag-cause na agad siya ng deprivation sa cell and the cells did not anymore responded to the function. At alam po natin that the brain is the central organ for the functioning of the body. Thank you very much, Ms. Torre, for that analysis. Any other? Okay, so maybe later on, so we are just on the first slide and we are just on the course description, but we have already discussed on how you will definitely understand this subject matter. So I will just read questions from the I have questions in the chat box. So probably ito ay related kanina. Sir, may mga underlying conditions ba na po kasi sila kaya mababa na rin yung immune po nila? Okay. I think ito yung situation or topic we have discussed kanina related to the elders and the children. Underlying conditions wherein kung halimbawa children may cancer. Yung child ba na may cancer, ay affected ang kanyang immune system? The answer is yes. Vulnerable ba yung child na may cancer? The answer is yes. Anything related to cellular function may affect response of the body including immune system. Sir, may mga ayun, the same question. So you can address also questions in the chat box, ha? Okay, let us now proceed with the next. The next is about the course outcomes you may expect in the continuation of our discussion of pathophysiology. Number 1, distinguish environmental factors, physical, psychosocial, cognitive characteristics of various diseases and conditions. Okay. You have I know you have known what is modifiable and non-modifiable risk factors. Can anyone define what's the difference between modifiable and non-modifiable risk factors? If you have encountered it, modifiable and non-modifiable risk factors. Okay, so meaning the silence may need my further explanation on it. Okay, if we say modifiable, if we have modifiable risk factors, these are the risk factors that can be changed. Okay, can be changed from the term itself, can be modified. Example, lifestyle. From a person who is smoking, can a person have the choice to stop smoking? The answer is yes. Nutritional management, will that be modifiable? Yes, because the person by choice can change his or her diet who could be risk of heart problems. How about non-modifiable risk factors? These are the factors that definitely cannot be changed. Now, what are those factors that cannot be changed? Can you change the age? I'm hearing answers.
Age po.
Yes, very good. The age cannot be changed. And you will refer to literatures of what are the ages that a person could be high risk of certain diseases. Diba? If you will read some of the credible sources and references, they sometimes identify, or it sometimes identifies specific age of why persons are high risk. Just similar with COVID-19. For example, a 67 years old who has been already on the late adulthood, you cannot change the age. He is already identified as highly vulnerable or high risk individuals. Another non-modifiable risk factor is definitely the gender. Okay? So the gender for a male and female. Do it have a different response when it comes to deviation of physiologic function? Yes. Majority of the hormones are present in male and female. However, there is a difference. There is a significant difference when it comes to the level. Testosterone are much higher for male. Progesterone and estrogen are much higher for females. So the responses and the physical features could be different. Why? Since progesterone and estrogen is higher for female, the increase in the number of the increase in the hormones itself stimulates the enlargement of cells and tissues that causes the specific features different from the from males. That's why if you will notice, right, males who are taking estrogen pills, progesterone pills, what are the expected changes for those males who are taking mga hormonal pills? Di ba nagkakos ng enlargement of breast? So that is the effect. So that's the difference for the male. We have the decreased level of that hormone, and for female we have the increased level of hormones that causes that made a difference of the physical features from a male to a female. So when it comes to that aspect of these factors to consider, it's really different yung factors when it comes to modifiable and non-modifiable risk factors. Another, when we talk about predisposing factors, if you remembered, when a person is having comorbidity, the higher chances that the person may develop complications of COVID-19. Question why? They are predisposed because the comorbidity itself, just like diabetes, just like cardiovascular problems, may lead to the complications simply because this may have a direct effect on the situation that for a person who may have diabetes, di ba usually ang problem with diabetes, uncontrolled ang blood sugar. If it is uncontrolled ang blood sugar, the problem is that of it may cause the viscosity of the blood thicker from what is expected. The thicker the blood ba or the highly viscous ba yung blood, the chances na slow ang circulation? Yes or no?
Yes po, sir.
So if the circulation is low, will there be a chances of delayed transport of oxygen to the specific tissues and cells? The answer is
Yes
yes.
po.
So now, when a person, both person or two persons rather, are exposed to the COVID-19 infection, one without diabetes and the other one with diabetes, the person who may not have the diabetes have a strong response to immune system because the circulation are intact to support the response of the cells. While for those who may have diabetes and chances to specifically consider the increase in the viscosity of the blood causing the delay in the oxygen transport may lead to the delayed response of the cells. On that manner, they may have different response. Who may have specifically be prone to complications. Both of them had been exposed to COVID-19. The other one have comorbidity. So obviously, the one who may have comorbidity, because the response to immune system is delayed compared to the one who do not have any comorbidity. So on that note, we are now having the realizations on the perspective by which situations like this may give us the idea of who is high risk, who is low risk, and who needs more attention and who may need immediate attention. Next po, number 2. Identify implications of therapeutic interventions for diseases and conditions. Example, let's go back to the situation of head injury. Okay? For the head injury, what could be the situation? What could be the situation if ever the person experienced head injury? We have already identified what could be the possible complications. Now, in this situation, if the nurse will be asked, what diagnostic examination could the person be subject to? Okay. If you're a nurse, what could be the possible diagnostic examination of the person experienced head injury? Answer. What are diagnostic examinations and laboratory tests that may identify the function of the brain?
MRI.
Sir, MRI scan po.
Very good. Magnetic resonance imaging. Any other? Any other?
Pwede rin po ba yung CT scan?
Correct. Very good, Miss Manguera. CT scan could be also a consideration. Any other? Any other? Do skull X-ray can supplement also a confirmatory test? Skull
Yes po.
X-ray.
Yes po.
Yes. So here comes your analysis. Skull X-ray, magnetic resonance imaging, MRI, and the other one is CT scan. Now, the next analysis on it is what specific results can I retrieve from skull X-ray? Since it's only X-ray, it may only identify the
Structure.
condition of the skull. If Mr. Guangco? Mr. Jude? I think I
Yes
have
po
heard the
din.
answer.
Structure po.
Correct, structure. So meaning, if the patient, if you are suspecting and if you wish to check if the client have fracture or skull fracture, do the X-ray can supplement you the results? The answer is yes. Do the skull X-ray can give you results of conditions of blood vessels?
No
Do skull
po.
X-ray can give you conditions of the blood vessel? No. Okay, correct. Correct. Do skull X-ray can give you conditions of the, if there is tissue death, if there is death of tissues, can it reveal can it reveal a result to
No
that
po.
effect of using skull X-ray of any tissue death?
No
The answer
po.
is no. Okay. So you're now familiar that the skull X-ray can give you can supplement if there is fracture. Next. What results can reveal and will guide the nurse using the CT scan? Okay, sa CT scan. Do the CT scan can identify problems with bleeding? Do the CT scan can identify problems with bleeding? The answer is
Yes.
yes. Do CT scan can identify problems with tissue death? The answer is yes. Do CT scan can give you results of the conditions of blood vessels of the brain? The answer is no. So the limitations of having the CT scan is it will give you a view if the client is having bleeding and if there is a problem with tissue death. But it may not specifically identify problems within blood vessels. Here comes the magnetic resonance imaging. Okay. In the magnetic resonance imaging, it will give us a clearer view of the specific parts of the brain, including the conditions of the blood vessels. Why? The MRI can give you the idea if what blood vessels are damaged, if what blood vessels are inflamed, and if what blood vessels, vein or artery had been damaged. So that is basically the difference. So that's why, what's the implication of that? If you have the result, initially for example, head injury, what comes to your brain is, what comes to your mind rather, what comes to your mind is, okay, head injury, the client will be subject for skull x-ray. You're thinking, oh, let us check probably in the skull x-ray, let's check if there is a problem with fracture or damage with the skull. Eventually, the client is unconscious. Okay, let us see if there's a problem with bleeding. Di ba kanina we have discussed na, oh, okay, the loss of consciousness may be brought about with the bleeding problem. Kaya di ba sa stroke, pag nawawala ng malay, usually ang examination is CT scan over skull X-ray. Kasi the CT scan will give us the idea if there is a problem with bleeding or problem with tissue death. And that gives you the idea that yung stroke of the client is due by any of the two. And that will be the basis for drugs and pharmacological management. Next, MRI. Yung client natin na may stroke, nakita nila may bleeding. What comes next? The client will be subject for continuous bleeding na nakikita nila eh. The client will be subject for repair of the blood vessel. But the next question is, what blood vessel could be repaired? It cannot be seen by skull X-ray. It cannot be seen obviously by, it cannot be revealed through the CT scan. So it could be revealed by the MRI. So this perspective in the pathophysiology is very important. That's why if you will have your case presentation or case study that may significantly consider na for example, skull fracture, okay. Primarily, it's X-ray. How about if your case are stroke? There could be two. The client will be subject for CT scan or the client will be subject for magnetic resonance imaging for severe conditions. Kasi usually pag mga aneurysms, aneurysm usually the blood vessels are mostly affected, ay usually yan, magnetic resonance imaging. So this will give you the idea on how you will have the confidence of subject or of subjecting the client to specific and appropriate diagnostic examination. So I think in the 1.5 hour of our discussion, you deserve a health break. I felt that very exhausting na yung 1.5 hour. So probably I may advance the health break at this time. We could have 15 minutes of your break for you to attend to your needs. Hydrate yourselves. You may have a bladder break and attend to your physiologic needs. We will be back since it's already 6:06. We will be back after 15 minutes. Thank you so much. So again, students, we will resume our discussion, hoping you have been refreshed and have been hydrated so that we will have our continuation of the discussion. So we have already identified the course outcomes that are expected for the subject of pathophysiology. Let us now proceed with the next. Demonstrate, number 3, demonstrate with a basic understanding of the concepts and elements of diseases. Okay, the one in particular we are talking about with the number 3 is the foundation that you have learned in your previous semesters and year levels. Just like, very important that you have learned concepts in anatomy and physiology. You have learned concepts in health education and health assessment, fundamentals of nursing, and some of the procedures in the professional courses in the first semester. That's why in pathophysiology, this course had been introduced to our second year students to have an understanding on how and on how the nurse or the future professional will attend to the basic concepts and will be useful for appropriate care management or intervention. A typical example, for example, the client is subject or was subject from the CBC. So we are aware of the diagnostic examination of complete blood count. In the complete blood count, what are the basic elements? I know for a fact that since you have been subjected to medical clearance, I know what are the basic components that you have seen in the complete blood count. What are the basic components that had been evaluated in the complete blood count?
Yung count po ng CBC, din.
Yes. What are the
Tapos,
components in that diagnostic examination?
yung sa hemoglobin po.
Okay, hemoglobin.
White blood cell po.
White blood cell. Any other?
Hematocrit po.
Hematocrit, very good. Any other?
White blood cell count po.
Okay, so mentioned, we have white blood cell. Yung, if we have the hematocrit and hemoglobin, then it is carried by the red blood cell. Okay, yun, red blood cell. Do we have also, it was tested din ba ang platelet ninyo? Platelet
Yes
count?
po.
Yes. So, actually, we have pa differential count dyan. But I will just focus on the basic understanding of the elements of the complete blood count. For example, in the red blood cell, okay, the red blood cell, if the RBC is below normal range, what could be the possible condition that the client may have?
Anemia po.
Correct. Okay, anemia. How about if the client is having increased RBC?
Polycythemia po.
Polycythemia. Very good. Next, how about if the person is having increased hemoglobin? The hemoglobin is the one that carries the oxygen. So if it is increased hemoglobin, anyone? The client may experience hyperventilation. Why? Because too much it's above the oxygen requirement, although it will be supported by the oxygen saturation. How about the deviation or level of hemoglobin that is lower than the range? So obviously the opposite is hypoventilation. Next, how about hematocrit? Hematocrit is in relation to the viscosity of the blood. Viscosity, ibig sabihin the blood texture. If the client may have increased hematocrit, the client's blood is hyperviscous. And there's hyperviscosity. If there is a decrease in the hematocrit, there's hypoviscosity of the blood. Let us now connect RBC, hemoglobin, and hematocrit. If we have decreased RBC, you have answered anemia. In anemia, do we have sufficient amount of volume of blood or insufficient amount of volume of blood?
Insufficient.
Correct. Insufficient amount of volume. So lesser volume. Somehow, if we have decreased RBC and anemia, will it be hypoviscous or hyperviscous? Hypoviscosity or hyperviscosity of the blood?
Hypoviscosity po.
Hypoviscosity. So now, let us now connect. If there is a decreased RBC anemia, the volume of the blood is decreased, which is hypoviscosity. The hemoglobin is decreased oxygenation. So it is connected with each other. That's why, are there any situations that the client experienced or was diagnosed with severe anemia? Is there chance that the client will undergo blood transfusion?
Yes po.
Correct. Because eventually, from that perspective or concept of decreased RBC, hemoglobin, hematocrit, the volume is also decreased. That's hypovolemia. Okay. Hypovolemia, hypo, decrease, volume, emia, blood. So the client is having hypovolemia. Next, on the other hand, if the client is having polycythemia and we are talking about RBC, it is expected that the client have increased hemoglobin, right? So there could be hyperventilation and chances that the client is having hyperviscosity of the blood. Too much red blood cell level may lead to hyperviscosity of the blood. It means the hyperviscosity of the blood ba may lead to clotting, possibility of clotting pag too much yung lapot ng blood?
Yes po.
Yes. So will that cause a possibility of the obstruction of the blood vessel and delay circulation?
Yes po.
Yes. So that's why those are the things that you need to watch out if there will be polycythemia. Okay? So now you may have now the difference. WBC. For the white blood cell, it will identify what problem. What could be the parameter that we may consider when it comes to WBC? Chances of what? Elevation pala. I'm sorry. Elevation, if there's elevation.
Infection po.
Infection. Okay. So it's either, remember this if there's elevation of the white blood cell, kasi response yan ng body, and you have some, one of your classmates responded that the WBC is connected to immune system. That is correct. That is an indication that the body is responding. So that's why there could be two things. It could be infection or inflammation. Now, the next consideration is that of, from the type of infection, how can we distinguish if it is viral or bacterial? So in the CBC, we have differential count. Sa differential count, ito yung mga basophils, eosinophils, neutrophils, lymphocytes. If you will see in a CBC result, if you wish to know if there is a problem with infection and you want to distinguish if it is viral or bacterial, if there's elevation in the lymphocytes, that is an indication, increased WBC, increased lymphocytes, that's an indication of viral infection. Next, if there's increase in the WBC and there's increase in the segmenters, That's an indication of bacterial infection. So, will this result be useful? The answer is yes. To what extent that it's useful? That WBC can give us a general interpretation of infection. Why is it necessary to know results of segmenters and lymphocytes? Because obviously it matters if it is bacterial and viral, because it may somehow connected with treatment regimen, specifically with the pharmacological management. So that matters. So will this be helpful? Yes, this is very helpful. Very basic ang complete blood count, urinalysis, fecalysis. That's why usually in mga annual physical examinations, these are the common examinations that the client may have simply because to identify pa lang on the CBC a possible infection or problem. If there are deviations in the CBC, then that follows through confirmatory tests to further identify the specific problem or diagnosis. So that is very important. Next, number 4. Demonstrate an understanding of the mechanisms of disease, diagnosis of disease, and treatment of diseases. Okay, now, I have already mentioned to you what is the importance or what are the importance of why we do patient history. It's for us to know the cause of the present chief complaint of the client, and somehow how the nurse will connect to the common and appropriate care management. Even in the absence of the doctor, the nurse could be independent in giving supportive care and care management to clients. So, number 4 example, sir. Can you give an example with the number 4? So, if we say mechanism of diseases, it will start from the risk factors until how these risk factors deviated or will cause the normal functioning to disequilibrium and how it may lead to possible complications, then death. Kaya po ang pathophysiology is on the diagrammatic presentation and flow chronological events. It's for us to know the how it may affect parts of the body and how the body respond to it. Oh, let's not go far. Let's have the COVID-19. We have the COVID-19 or the SARS-CoV-2. The SARS-CoV-2 are basically identified where to enter. Di ba we have considered that the infection can be harbored through droplet. And once it will be inhaled, saan siya papasok? It will start with the upper respiratory tract, right? Upper respiratory tract, then basic foundation in the anatomy goes with the effect to the what? Where? After the nasal cavity, saan siya papasok? Papasok siya sa pharynx. Pagpasok sa pharynx, papasok sa larynx. And after the larynx, it will proceed to trachea, bronchi, bronchioles, then the lungs. Will this be the same as the flow of oxygen that you inhale? Yung flow of oxygen, the same din ba yung pathway niya? The answer is yes. Once you inhale the oxygen, it will pass through the nasal cavity, it will pass through the pharynx, passes through the larynx, the trachea, the bronchi, the bronchioles, then going through the lungs. Will there be a possibility that the SARS-CoV-2, which is the cause of COVID-19, may lead to lungs? Will that be possible? Will the virus can enter until the lungs? Yes or no? Will the COVID-19 virus can enter until the lungs or will just be in the upper respiratory tract? Yes? Answer. I need answers.
Yes.
Students? Okay, some answer. I hear one. Okay, I may now proceed to the chat box. Okay, yes. How about the others? We are already we are 44 here in the nabawasan pa ng isa, may na-disconnect. We are 43 here now, and the 42 students are with me. Can I hear answers? Will that be possible if
Yes
the
po.
virus that enters the upper respiratory tract may lead to the lower respiratory tract?
Yes po.
Yes po.
Yes, yes.
Yes po.
Okay, now, that's why we may conclude if the virus, if the SARS-CoV-2 enters the nasal cavity, di ba usually yan, ang common site niyan of the production nasa upper respiratory tract. Kaya dun nga tayo nag-inoculate ng test eh. Then once it will be aspirated towards the lungs, that's the time that the virus may cause damage to tissues. And that's the time that there could be a possibility that the client may have infection. And usually, the complication that it may have for COVID-19 is pneumonia, right? So that is an indication that the virus may reach extensive damage to the lungs. So that answers the flow on why usually for COVID-19, once it reaches the lungs, you may suspect for chances of pneumonia. That's why the client is experiencing difficulty of breathing. Kaya that's why when we conclude on the situation na if the client is experiencing difficulty breathing, it's considered already critical. The condition is very critical. To what extent? Because possibly the SARS-CoV-2, which is the virus, already extend its damage to the lungs and possibly developing pneumonia as a complication. So now we have concluded na the complication is very important. So that's why it's very important that you need to monitor the signs. The more signs that have been identified and it leads to a severity or increased severity, the greater chances that the condition or the SARS-CoV-2 infection reaches the lungs and may start its damage. So, sir, why is it that some who may have comorbidity leaded to the death immediately? As what I mentioned, a person who may have diabetes. Di ba the response of the body is dependent on the cells? And as what I've told you, for persons who may have diabetes, the blood viscosity is high. The blood sugar is high, the viscosity is high. So delay in the transport of oxygen and nutrients to the cell. Delay response of the cells to protect the lung tissues. And here comes the virus that starts to spread and continuously damage the lungs. That's why for those who may have comorbidities, they are already considered as high risk for developing pneumonia. They are the ones who may possibly developing pneumonia. Lalo na other than comorbidity, the elders. So we can see now, di ba class, you have encountered or you have observed in hospitals, we have triaging. The triaging is a way to prioritize who among the patients may need immediate need. All of them probably may have COVID-19. The 20 patients in the 10 may have COVID-19. But the triage system or the triage nurse may significantly identify who among them may need frequent monitoring. Those who have more symptoms may possibly or may higher complications or risk for complications may be the one that will be monitored frequently, because the chances that the more symptoms and signs have been identified, the chances that it's critical and possibly the damage had been extended in the lungs. So that's why nurses, pathophysiology is very important. It may depend. It will depend on how you will triage clients. It will depend on how you will prioritize appropriate care management. And it will depend on you on how you will prevent complications. Number 5, understand the pharmacological treatment of diseases or condition. Okay, one of the examples that I mentioned a while ago is pertaining to the viral and the bacteria. which is obviously pharmacological treatment is very necessary and very important to know, because if it revealed in diagnostic examinations that the client have viral infection, obviously supportive measures and antiviral drugs could be given. If the client may have bacterial infection, so very obviously the client may have antibacterial. Sir, can you set other examples on this? In pharmacological treatment class, we are aware every drugs has indications. And the indications itself is the one that will give us the idea of why this pharmacological treatment is necessary for that condition. Let's have a condition related to aspirin. Okay? Aspirin, rin, is an anticoagulant. Okay? An anticoagulant. For example, let's go back to the situation of the stroke patient. Why you have noticed that most of the stroke patients are given aspirin? Why of most of the stroke patients are being prescribed with aspirin? The answer is, if the client had been identified of having a risk with possible bleeding, di ba usually ang common dyan sa atin, ang response ng body natin, di ba pag bleeding, magi-stop siya pag nag-clot na siya. Pag nag-respond na si platelet, right? Now, just the same as for the brain. If there will be identified bleeding in the brain, it will stop the bleeding but may lead to clotting. Do you think the formation of clot may cause obstruction to the blood vessels? Do you think that formation of clot will cause an obstruction to the blood vessels? Yes or no? Yes. Do the obstruction in the blood vessel caused by the clot may cause delay in the flow of blood to the circulation of the brain?
Yes po.
If it will cause a delay in the circulation, will it also be delayed ang distribution of oxygen to cells?
Yes po.
And if it will cause a delay in the distribution of oxygen to cells, will it lead pa into hypoxia and tissue death?
Yes po.
The answer is yes. Kasi, class, for a patient who have stroke na ang cause ay bleeding, pwede siyang mag-lead to another type of stroke na ang cause naman ay problem with oxygenation, and that is ischemia. So on that note, you can now relate how or why the client is given aspirin. It is basically to prevent the clot. And why the clot must be prevented? Because the client had been identified with the cause of stroke due to bleeding. And with that clot, it may cause the possibility of secondary problem such as ischemia. So those are situations by which nurses must prevent. So that's why the drugs, the pharmacological management could be a preventive measure to prevent secondary complications. Number 6, discuss common laboratory and diagnostic tests, which I have elaborated already in some of the course outcomes that I have mentioned. Now, let us start on what is physiology. When it comes to physiology, from the term itself, physio, okay, physio, we are referring to functioning. Okay, physio stands for functioning. And actually, it is very important to know, that's why in health assessment, you have been oriented of what are the expected reflexes that you must identify to a newborn. Okay? Because reflexes itself is very important to assess because it may identify problems with nervous system. Diba? So why do we need to do APGAR scoring? What do you mean by APGAR? Anyone? What do you mean by APGAR? I think this was
Appearance, pulse.
appearance, correct.
Grimace, activity, respiration.
Appearance, grimace, activity, and respiration. Okay. Those scoring itself will give us the idea. Once you do the scoring, you must know the normal. Okay, the normal appearance, the normal respiratory rate, the normal respiratory rate of a newborn. That's why, 'di ba usually ang newborn niyan mas mataas ang respiratory rate compared to an adult. That's why if you are not aware of the common and the normal vital signs may vary every age group. That's why it's very important. You will mention, okay, anyone nga, I will ask if you can still remember what we have studied in pharmacology. What is the normal blood pressure? Sige nga. What is the normal blood pressure?
120/80.
Ayan. If you can still remember on our discussion related to the level of blood pressure, 120/80 is already pre-hypertension. 'Di ba? So, yung normal blood pressure, it must be below 120 and below diastolic of 80. Kasi 120/80 is already pre-hypertension, which is based from the JCI, okay, JCI classification, JNC 7 classification of hypertension. Will that be necessary for the nurse to know? Yes. Because if we say 120/80, ma'am, that is normal. Pero the 120/80 is considered already as pre-hypertension, meaning you still need not to be comfortable because the baseline of 120/80 must be checked also with the next 4 hours of the blood pressure. It will have chances to elevate from 120/80. So that's why future nurses, central Lino nurses, always answer 120/80 as pre-hypertension. So what is the normal blood pressure? Ma'am, below 120 systolic and below 80 systolic. So ibig sabihin niyan yung 119 systolic, 80, 118, 117, and so on and so forth. Pero yung hypotension naman is different naman. Pag if it is already reaching 80 and below, yung systolic. Now, when it comes to the diastolic, must be 80 and below, 79, 78 and below. That's why if you will notice in the records of clients, when you observe in the reference books with foreign authors, usually they reflect blood pressure of 119/79, 110/20, 110/19. It's because it has a very significant interpretation when it comes to DNC classification of hypertension. So yon, very important yon. So as what we have mentioned, when it comes to the physiology, it's part of the biology. I know it's the study of life, obviously, of the human person when it comes to functioning. So that's why if we say physiology, that's why it's anatomy and physiology. The anatomy is more on the structure and the physiology is more on the functioning. If we say circulatory system, the structure that we are known and aware for is the heart and blood vessels. If we talk about the physiology of the circulatory system, we're talking about the circulation of blood that is distributed by the blood vessels through the functioning of the heart. So that is the physiology. So we may know, that's why we may know what is the normal cardiac rate, we must know what is the normal blood pressure, and we must know the basic vital signs simply because it may have an implication on the possible deviations and directions in pathophysiology. Do you have any questions? Please don't be hesitant to ask questions. You may unmute, you may raise your hand, or you may post a question in the chat group if you have clarifications. Hearing none, so I will continue. Now, the next is, let us now further define what is physiology. If we say physiology, we have mentioned in the first slide that it's the normal function. And if we elaborate more the normal function, it will give us the idea of processes. Okay, processes. Now, I will ask you, I will mention the system. I will mention the system, then respond to me what are the processes involved. Example, if I will mention circulatory system, what are the processes? Obviously, circulation of blood. Okay. So next, what are the processes involved in integumentary system?
Protecting internal organs.
Okay, protection. Okay. So it goes na with the function eh. Protection of the internal organs. Pag tinanong natin yung anatomy, integumentary system, we're talking about the skin. So yon. So we are aware now of the difference. Next. How about the endocrine system? What are the processes involved?
Production of hormones po.
Very good. Production of hormones. If I may consider endocrine system anatomy. Anatomy. Endocrine system.
Glands po.
Glands. Very good. So pituitary glands, adrenal glands. So those are basic for anatomy because we're talking about organs and structures. But if we're talking about the function, this is more on physiology. Okay. Another example, because later we will have a review of the systems of the body. Nervous system. If we talk about nervous system, what are the processes?
Transportation po.
Transportation, be more specific. Transportation of what?
Transportation of
You're
movements
hitting there.
po.
Transportation of
Movements. Ayun.
movements. Baka
Bali po.
probably you're getting there. So you need to have the appropriate or the correct term to use. You're gearing towards the correct answer.
Transportation of neurotransmitters po, sir.
Ay, yon. So pag sinabi natin, ang process natin dyan ay neurotransmitters or transmission of impulses. Transmission of impulses, neurotransmitters. Okay, if we talk about nervous system, anatomy.
Brain po.
Brain. Any other?
Spinal cord.
Spinal cord. Okay. So now you can now distinguish another processes. If we are referring to digestive system, processes for digestive system.
Digestion po.
Any other
Mechanical
digestion?
and mechanical digestion.
Mechanical digestion. Very good. Any other pa? Digestive system.
Breaking down of foods into nutrients.
Very good. So now you are learning. When we talk about anatomy, anatomy on the digestive system, anatomy. Stomach. Okay.
Esophagus.
Esophagus. Yan. So now you are now connected on what could be the one that I'm referring to. If we are considering pathophysiology, di ba, the patho that I mentioned is the disease process. The physiology is on how the body was affected of that particular disease. That is now we are connecting what pathophysiology is. So let's now proceed. The study on how the body parts work or function. So we have mentioned that the physio is the nature, the ology is the study. So if you say the nature, the specific function is distinct on that particular system or organ. So let's now proceed to the specific organ na tayo. Circulatory system, heart, processes. What are the processes that may involve the heart? processes for the heart?
Pumping of blood.
Pumping of blood. Okay. Any other? Pumping or ejection of blood. Any other?
Provide cells with nutrients.
Okay. Transporting or provision of nutrients through the circulating blood. So, you have mentioned about the pumping of blood because the heart is a highly muscular organ that is capable of contraction and ejection of blood. So that's a process. That's the process itself. Do you think that to be deeper in when it comes to the processes of the heart, is the heart also responsible for the conversion of unoxygenated to oxygenated blood?
Yes po.
Yes po.
Yun. So kung for example, let's have a problem with the heart. For example, there's inflammation of the tricuspid valve. Okay, inflammation of the tricuspid valve. So, if there's inflammation of the tricuspid valve is located on the left side of the heart or right side of the heart? So, tricuspid valve, left side or right side of the heart? Tricuspid. Students, 43 students. Tricuspid valve. Where is the tricuspid valve?
Right po.
Right side. Yan. So, mukhang ready yung Google Right side of the heart. So, sa right side of the heart, do we eject oxygenated or unoxygenated blood? Right side. Did it receive oxygenated or non-oxygenated? Right side of the heart.
Oxygenated.
Remember right side
The
of the heart
oxygenated po.
Deoxy po.
Anoxy. Okay, so unoxygenated blood. If there's inflammation of the valve, the opening of the valve may not be this way as a normal. Okay? If there's inflammation of the valve, will it be possible that the blood that enters the right side may not be ejected? Kasi inflamed Will that be possible? That the blood from the right side may not be
Yes
ejected?
po.
Kasi the opening of the valve is very important, di ba? So that the blood from the right atria goes to the right ventricle. But since there is an inflammation of the valve, there is a possibility that the blood coming from the right atria will not proceed to the right ventricle. Okay, next. We will connect the process, Will it be possible since the blood is not proceeding from the right atria going to the right ventricle? Will it be possible that the blood will be retained in the right side of the heart?
Yes po.
Is it possible that because of that problem with the tricuspid valve, it will increase the volume of blood in the right side of the heart?
Yes po.
Okay. If it will increase the volume of the blood sa right side, is it possible to increase the size of the heart?
Yes po.
So, will it be possible that it will lead to enlargement of the heart?
Yes po.
And that's the time that there could be chances of problem with cardiomegaly or enlargement of the heart. So, first, yung chronology of the events. The problem is inflammation of the valve. You will now connect to the process. You have mentioned that the heart is responsible for ejection of blood. Okay. When the blood enters the right side of the heart, and if there is inflammation of the valve, so basically this blood will not be ejected. The next thing is that of if the blood will not be ejected, it will be retained in the atria or ventricles of the right side of the heart. So if it will be retained, and the process of refilling is continuous, and once it will increase the volume of the heart, it will overstretch the muscle. Once it will overstretch the muscle, it will cause the enlargement of the heart. If the blood will retain on the right side, do you think there will be less blood that will be ejected by the blood sa left side? Yes or no? If there will be If there will be retention of blood in the right side, would you think there will be less blood that will be ejected to the left side of the heart?
Yes po.
If there will be less blood to be ejected in the left side of the heart, do you think there will be decreased cardiac output?
Yes po.
Yun. So parang si Miss Tanghal lang yung nadidinig ko nagre-respond. How about for the others? So on that note, it gives us the idea na the enlargement of the heart pala may deprive cardiac output at it may suffer and compromise the supply of the blood going to the brain, going to the kidneys, and going to the major organs. Kaya pala, sir, very critical po pala pag enlargement of the heart, sometimes ang client risk for stroke. Yes, kasi decrease ang cardiac output niya at decrease ang blood supply going to the brain. So that gives us the process of a normal functioning of the heart and its effect if there's already deviation in the structure or anatomy. Is it understood? Any reaction? Objection? Order in the court? Silence. Yun yung nadidinig ko, silence. Are you still with me? Can I hear responses?
Yes po.
I'm just worried if
Yes
I
po
have
din.
I'm just worried if I have auditory problems na or somehow I am now in spirit and I am not I am not connected with you. Can I hear answers from the others?
Yes po.
One.
Yes po.
Yes po.
Yan, yes po,
Yes
yes po.
po.
Parang out of 43 ang nadidinig ko na lang 10. Okay
Opo.
ha? So don't be hesitant. I would really love for the others to participate. Kaya that's why later on I will call kasi medyo less yung responses natin. I will call others to respond with questions ha. Sige. Next. Let us now discuss of what is physiology. Okay. What is the physiology can be divided into the following specialties. If we say cell physiology, this is in particular the study that will focus on the cellular function. Kasi physiology nga eh. So obviously we will connect it with the cellular function. Okay. I know for a fact that you have studied about the cell structure. Diba meron tayo dyan? Ano yung mga parts of the cell?
Reuse.
Mitochondria po.
Mitochondria.
Golgi apparatus po.
Golgi apparatus. Ano pa? So dalawa lang pala yung parts of the cell.
Nucleus po.
Nucleus. Okay. Any parts of the cell? Any parts of the cell?
Nuclear membrane po.
Nuclear membrane. Oh, sige. So hoping very basic 'yon. You must remember those. Kasi ang cell ba has electrical charge? Yes or no? Do cells have electrical charge?
Yes po.
Yes
Yes.
po.
So that's why the cells are capable of transmitting impulses, electrical impulses. Okay. Now, let us now connect again with the heart. I really love the heart because this is a post-Valentine discussion. Okay. So we have the electrical charges. Now, since the heart is a highly muscular organ, so it's very obvious the heart will contract and relax. Contract, relax, contract, relax. You are familiar with the systole and diastole, right? During the systole, the heart contracts or relax?
Contracts po.
Contraction. And obviously, for the diastole, we have relaxation. Okay, now. When is the time? What will be the charge of the cell if it will cause muscle contraction? What will be the status of the cell, the electrical status of the cell for muscle contraction of the heart? Positively charged or negatively charged?
Positively charged.
Positively charged. So it will lead to contraction. And during relaxation, the cells become what? negatively charged to facilitate relaxation. Kaya class, when you're experiencing anxiety, what is expected with the heart? Sympathetic or parasympathetic? Ayan, it goes back again to that, sir. If you are anxious, will it be sympathetic or parasympathetic? 43 students in the house. Para or simpa? Oh, now it's the time for me to call. Okay. Can I ask Briggs? Ignacio? Okay, good. I heard your voice. What is the condition or what is the response if you are anxious pertaining to heart? Sympathetic or parasympathetic?
Parasympathetic po.
Parasympathetic. Any other answer? Any other answer?
Sympathetic po.
I would like to call Miss Mahilom. Miss Mahilom, when you are anxious, is it sympathetic or parasympathetic? Miss Erica. Miss Erica is disconnected. How about Miss Ozawa? If you are anxious, is it sympathetic or parasympathetic?
Sympathetic po.
Sympathetic. Okay. Now let's reveal the correct answer. The correct answer is sympathetic response. And that facilitates increased heart rate. If there's increase in heart rate, expect the cells are positively charged or negatively charged. Answer.
Negatively.
I will repeat again. If the heart contracts because of sympathetic response, syempre you will answer talaga the opposite. the positive or negative? I want to hear from you. Answer.
Positive.
Positively charged. Okay. So, nadagdagan yung boto natin. Positively charged. So, it means that you really need in pathophysiology to really know yung significance of cell function as a whole. Kaya that's why even with my discussion a while ago na if the cells will be deprived from oxygen, ang tawag doon, the term called is hypoxia. And once it may lead to hypoxia, the greater chances that it may lead to tissue death, and that is fatal. So yun ay in particular that I would like for you to review. Okay ha? This could be my assignment. I would like you to review the functions of the cell, yung basic function of the cell, because this will give you an idea on how you will connect the problems with cell to the different organs and tissues of the body, so that you will connect if there will be deviations from signs and symptoms, from manifestations, from any injuries and damage to tissues. Okay? Can you promise me that you will review the functions of the cells?
Yes po din.
Yes po din.
Yan, good.
Yes
Very good. Now, let us now proceed with special physiology. If we talk about the special physiology, we're talking about the study of the specific organ. Okay, now, can you give me an example of organs that can be transplanted?
Kidneys po.
Kidneys is one. Any other?
Heart. Corneas.
Heart can be one. Okay. Cornea can be?
Liver po
other?
din.
Ha?
Liver po.
Liver. Okay, liver transplant will do. Liver or liver. Next. Brain? Could brain can be transplanted? Probably it would be a milestone sooner or later. But for now, we don't have the brain transplant. It could be a repair, but we may not have the brain as a transplant. Maybe in the future as a milestone. So now, why not all organs can be subject for transplant? It's because these specific organs can replace a damaged organ from the healthy persons as a donor, because it's proven from the studies that it could be capable of functioning. Kasi most that we are familiar with us is kidney, right? Kidneys that are responsible for the excretion of waste products and balance of the fluids, of fluid regulation of the body. So because the kidneys can be transplanted and it may function well, because it has a proven study that the functions of the kidneys can be in a perspective that the person may live a normal life. But I will ask you, can a person live with one kidney?
Yes
Yes
po.
po.
Yes.
po.
Can a person can live with one lung?
Yes po.
Yes po.
Yes. What is the point that the person could be on that perspective? Because there is one reserve kidney, because we are aware of two kidneys. For lungs, we could have one lung that can still function. However, it could be a different level of response if we do have only one kidney and one lung for that person, because it may be different for a maximum ventilation and gas exchange for a normal person compared to a person with one lung. And for a perspective with the person who may have one kidney to a person with complete kidneys. So those are the situations by which we could identify and maximize our thinking of the possibility who could be most high risk, who could be individuals may lead to a possible complications, because the specific organ itself could be specifically be identified as chance for recovery. Example, I just want to ask, we will connect. If there will be a problem with process tayo, if there will be a problem with blood pressure, what major organ will respond to the regulation of BP? What organ could help the heart in regulating the blood pressure?
Po.
Ha?
Ano ba heart po?
The heart, kasi the heart is the one that regulates blood pressure. But if there is hypertension,
Kidney
what
po.
other yes, the kidney is connected with the heart. Okay, the kidney is connected with the heart to facilitate regulation of blood pressure. Another, how about acid-base balance? If we're talking about the acid-base balance, this is in particular with the acidity and alkalinity of the blood. One of the organs that are identified when it comes to acid-base balance are the lungs. What is the other organ that will help in acid-base balance? What organ or organs?
And liver.
Kidneys. Very good. Okay. So nako-connect na natin, 'di ba? That's why let's now connect that why a person who may have hypertension could be high risk also of damage of kidneys, because the two organs compensate with each other when it comes to the regulation of blood pressure. Another, if the person's kidney is not functioning, what major organ will be affected? The heart. So eventually, it may affect blood pressure. So they're connected with each other. So another, when it comes to the acid-base balance, we have mentioned the relationship between the lungs and the kidneys. We all know that the kidneys excrete waste products through the urine. The lungs excrete waste products through the exhaled air. So what is the waste product or the gas that had been released by the body as for the lungs? Ano yung ine-exhale na gas?
Carbon dioxide.
Carbon dioxide. Very good. Most of the kidneys regulate bicarbonate. So these two, carbon dioxide and the bicarbonates, are the components of the two, okay, components of the two organs that is very important for acid-base balance. Kaya if the lungs has a problem with acid-base balance, the kidney is the one that will regulate bicarbonate. If the kidneys are having problem with acid-base balance, the lungs naman will regulate the carbon dioxide. So they are connected with each other. That's why if there's a problem with the lungs, it will also concern its connection of damage possibly of kidneys. Kaya that's why class, it is very important for nurses to know what to monitor when there's a certain disease that had been identified. That's why, for example, diabetes. For a person who may have diabetes, increased blood sugar, obviously related to blood. The blood is circulating where? The blood is circulating what structure, anatomy? Where? Where's the blood circulating? What facilitates distribution of the blood? What structure? Blood?
Vessels.
Blood vessels. Okay. Would you think that a person who may have diabetes of increased blood sugar, and what is the effect of the increased blood sugar? It will cause increased viscosity of the blood. Do you think that major organs will be affected specifically on the viscosity of the blood? Yes or no?
Yes po.
Yes po.
Yes. Kaya that's why for persons who may have diabetes, di ba they are prone to a problem with eye? Kasi blood vessels may rupture because of the high viscosity of the blood. Person with diabetes may cause a problem with kidneys. Why? Because basically, it may cause a problem with the circulation of renal perfusion. A diabetic may also have a problem with the heart because blood vessels in the heart may be affected. So, we are aware that blood vessels are distributed in major organs. Kaya that's why we could connect the for a person who may have diabetes, the blood is affected, and the structure that carries the blood is the blood vessels. So blood vessels are distributed to the organs. So there's a possibility that there could be multi-complications if the person has diabetes. So we must monitor, okay, as nurses. Okay, next. What is systemic physiology? If we say systemic physiology, the physiology that can be divided is specialty. If we're talking about the system, the study of the system, this is systemic physiology. Example, if we say circulatory system, then it studies about the function itself of the circulatory system. And what's the function of the circulatory system? Distribution of the blood. Okay. What is the basic function of the digestive system? The system that is responsible for syempre you will mention digestion. You will mention specifically on the breakdown of food, removal of waste products, responsible from the digestive process. So from that orientation, aware kayo that these are the orientation of functions of each system. So next po, the pathological physiology. Okay, from the term itself pathological. Di ba sabi natin, if it is pathological, there's already an identified disease. So ibig sabihin, if we say pathological physiology, we're talking about the effect of the certain disease to the processes of the body. So, example, the one that I have mentioned, we have the diabetes, and since it affects the circulating blood, it may affect distribution of blood, it may affect the organs, it may affect tissues. So we can now associate the connection. So another example is that of pathological. Example, peptic ulcer, gastro. Kung for peptic ulcer, what system is involved? Peptic ulcer, digestive system. For peptic ulcer, what particular organ is affected?
Stomach.
Stomach. The stomach regulates what acid? The stomach regulates what acid? Hydro?
Hydrochloric acid.
Okay, very good. Kala ko hydrocarbon. Hydrochloric acid. If it regulates hydrochloric acid, what specifically in the stomach regulates hydrochloric acid? What part in the stomach stimulates hydrochloric acid? Obviously, the stomach cells, di ba? The stomach cells. So, yung stomach cells, may connection siya sa regulation of hydrochloric acid. May connection siya specifically on the peptic ulcer. So, ano yung problem? Ang problem natin, pathologically, the disease is peptic ulcer. So, how we will connect dun sa organ, sa system, sa tissues, at saka sa cell? Hydrochloric acid is regulated by the stomach cell. If we have peptic ulcer, from the term itself, ulceration, ulcer itself is a damage to tissues. So meaning, if there's a damage to tissues, it may affect the cellular function. If it may affect the cellular function, it may affect its function to regulate hydrochloric acid. Will there be a possibility for a person with peptic ulcer to experience hyperacidity? Yes or no? Will there be a possibility ang peptic ulcer maka-experience ng hyperacidity or increased acidity level sa stomach?
Yes po.
It will not be controlled because the ulceration in the stomach, the cells itself involved in the regulation are not functioning its normal process. Class, remember, why is it that you may not have peptic ulcer or gastric ulcer and yet you are not eating for 8 hours? You're not eating for 8 hours. Your stomach is empty. Your stomach cells regulate low level of hydrochloric acid. So, it may not cause ulceration. Kaya that's why most of my peptic ulcer, pag may cause na yan sa tissues, nagigising. They usually be awakened early morning because that's the time that the stomach cells are not efficiently controlling hydrochloric acid. Kaya that's why if you will experience that and you will be awakened in the middle of early morning and you experience hyperacidity, check nyo agad if you have a problem of possible peptic ulcer. Na-connect ko ngayon yung pathologic physiology because I'm aware that the cells are responsible for the hydrochloric acid production and regulation. So if there will be a damage in tissues, obviously it may cause an effect to the cell. Okay, next. Okay, I know for a fact that you are aware of this. Was this discussed in your anatomy? Yung 6 structural and functional organizational of the body?
Yes po.
Yan. So let's have a review. On the chemical level, I need to introduce to you again this concept simply because for you to identify the connection of why do we need to have the master of 6 structural and functional organization of the human body. But first, I would like to entertain a question here. Din question po, bakit po may organ failure? Bakit po may organ failure pa din kung healthy po yung organ? Bakit po may organ failure pa din kung healthy po yung organ? Okay, ganito yon. For example, sometimes you may encounter multiple organ. Ayan, multiple organ dysfunction. A healthy organ can be affected to a certain type of pathologic conditions or disease. Example, the problem is hypertension. Okay. The problem is hypertension, tapos you will wonder na why the client is having healthy kidneys, pero eventually she was diagnosed with kidney failure. There's something. A while ago, di ba, we have discussed the connection of the kidney and the heart. Di ba? Both of them are helping each other for regulation of blood pressure. So that's why a healthy organ can be affected if the main processes and function is connected with one organ to another. Kaya pag may kidney problem kayo, di ba kanina we have identified two organs na connected sa kidney, yung lungs at saka heart. Kaya if you may have a damaged kidney, it may possibly risk or compromise the function of the lungs and the heart. Remember that. Okay, that's why as nurses, you need to connect what are the major organs that could be affected if one organ is failing. So that's the time that you need to have further tests. Sir, sabi niya, oh sir, my mom has hypertension. Why is it the doctor requested for the test of kidney? Because the kidney is connected with the function and processes of the heart in the regulation of blood pressure. That's it. Okay. So I think we will have this as our last topic of our lesson for today. Let's have the chemical level. On the chemical level, this is related on the composition of the cells. On the level of the cells such as the molecules and the atoms. These are very important. That's why I told you that on the simplest level, the molecules and the atoms have a major role when it comes to cellular functioning. That's why if there's a problem with the electrical charges that is mainly connected with the cell, it is mainly because of these molecules and atoms. Kaya that's why every electrical charges of the cell matters with the functions of our major organs and systems of the body. So please ask questions if you have clarifications. Number two is we have the what we call cellular level. From the atoms and the cell, we have the smallest unit of the living things where the molecules form organelles. So if you will notice from these atoms and molecules, na-form na siya into different cells. That's why class, cells could be identified with different structure. Di ba we have the muscle cells, the muscle cells, we have the what to call this, the epithelial cells, smooth muscle cells, epithelial cells, endothelial cells. So these are the cells that varies with each other and it can identify location. Just like for example, epithelial cells. Epithelial cells are identified in the stomach, identified in the lungs. If we have endothelial cells are identified in the brain. So we are aware that this structure or this cell structure, once it will cause a different view microscopically, doon na tayo di ba nagkakaroon ng idea, oh, why is it a different structure? Pag nakita yan sa view ng microscopic evaluation, there could be a possibility na they may be thinking of a possibility of further tests to identify problem with cancer. So that's why cellular cytology, from the term itself cytology, the study of cell, is very important because it has a distinct characteristics and features that may significantly identify if the chances of new growth of cells are high risk for malignancy or cancer. On that note, later. Next, on that note, we have the what we call tissue level. So it starts with atom. We have I will not have first the graded recitation. I'll stay there. So we have the what we call atoms and molecules, the chemical level. We have the cellular level, and here comes the tissue level. If we say the tissue level, it is composed of group of cells. If we will combine the groups of similar cells, for example, if we have a group of similar cells of epithelial cells, so that could be identified as smooth muscle cells. If, for example, if we group together epithelial cells that are grouped together on the part of the specific system, okay, these epithelial cells could group into tissues na. So that's why it's very important, based from our discussion a while ago, that if, for example, the cells will be, ganito po ha, If the cells will be deprived from oxygen, what is the effect to the atoms and molecules? If there will be deprivation of oxygen, it will affect the chemicals. The molecules and atom will not be, the molecules and atoms will not facilitate electrical charges. Or if it will not facilitate electrical charges, what comes next? What comes next? The concern will follow with the cellular level. The cell will not respond. If the cell will not respond because of hypoxia and will not facilitate its function as a cell, there is a possibility that a continuous deprivation of oxygen may lead to tissue death because every tissues are composed of cells. So that's why, for example, even with the heart, if there are portions of the heart that leads to a tissue death, ibig sabihin that group of similar cells are deprived from the oxygenation. Next, number 4, organ level. The organ level is composed of 2 or more tissues or types that perform specific function. Example, an example of the organ level is we have, for example, we have the urinary bladder as an example here. We have the kidneys. We have the part of the urethra, and we have the ureter. So these are the structures. These are the structures which could identify an organ. The kidney is an organ. The urinary bladder is an organ. So 2 or more tissue types are combined together. Now, after an organ, if it is composed of group of organs are work together to accomplish a common purpose, is organ system. So kidneys, ureter, urinary bladder, urethra is considered as a urinary system. So if we say urinary system, this is somehow responsible for the excretion of urine. So if I will be a nurse, if I am the nurse rather of the patient, and the patient has difficulty of urination, then I will think and evaluate the function of the urinary system. And what are the organs that I need to evaluate? Function of the kidneys and the function of the urinary bladder. That's why the patient could be subject for ultrasound. Kung nadidinig niyo yung KUB, hindi yun Korean group ha. KUB is an ultrasound that stands for kidney, ureter, bladder. Why that ultrasound will be subject as a diagnostic test for the patient? Because it has been identified that the processes of urination and the processes of urination are affected. So we need to know what specific parts of the urinary system or organs itself are not functioning well. Next, we have the organism. So obviously the number 6 is the one as a holistic that composed of the 11 organ system. So I think I may end up to this, and I will continue the discussion sooner to connect this one on the 6 structural organ and functional organizations of the body. So the next part of our discussion is our review of the different systems of the body: integumentary, the nervous system, the skeletal system, the endocrine system, the muscular system, the cardiovascular or the circulatory system, lymphatic system, urinary, respiratory system, digestive system, the male reproductive system, the female reproductive system. So those are the next topic that we will discuss as a review, so that we could have an overview of the foundation before we proceed with the discussion of the pathophysiology. So first and foremost, I just want to ask for clarification if you have any questions. Any questions? So if none, I will just like to stop the recording.